Congresswoman Frankel.
Yes, thank you, Madam Chair. Thank you. I want to thank your staff, Gloria Iludim. I hope I said her name right, but she really set us up well for this. And I'm finding this meeting actually very enjoyable, even though I'm sitting at home. That makes it even better. I didn't have to get on one of those planes. So thank you, Dr. Redfield, for your service to our country. I have a few questions. First of all, Dr. Redfield, do you agree that the CDC might have learned more about the virus and the necessary response had we had a greater global presence in the days and months leading up to the COVID outbreak?
You know, Congressman, I think we would have benefited enormously from having a greater presence, particularly in our CDC office in Beijing.
Thank you for that. And in your written testimony, you say that contact tracing is a core infectious disease control strategy and involves case and contact investigation followed by implementation of intervention. You've also, I know you testified at the Senate that contact tracing is going to be the difference from succeeding in containing this outbreak. So first of all, I just a few questions in regards to contact tracing. One of your former predecessors, Tom Frieden, has suggested a workforce of at least 300,000 people in the country to effectively contact trace. I'd like you to comment on that. And then a few other things. How should a community determine the right number of contact tracers they need to respond to the pandemic?
Thank you very much. I've spoken to Tom about this. I know his number, he estimated 300,000. I mentioned that I've estimated between 30 and 100,000. It is sizable. I think we won't really know until we work state by state. We have met with all 50 states and jurisdictions and some of the metropolitan areas that are cities that we have also, and to work with them to figure that out. I'm happy that many of the states have started to really expand. A number of them have already added 1,000, 1,500 contact tracers. We're working with them. CDC has made available through our foundation the ability for states. We will allow them to hire people to help augment the epidemiologist and the leadership group that they need. And then we're looking at them with the resources we gave them. We're hopeful that AmeriCorps will be another source. But we really have to get this built, and we have to get it built between now and September and get these public health workforces up. And in some states, it may be 500. In other states, it may be 5,000. We're in the process of doing that state by state by state to help them understand what is that workforce they need.
What exactly are you doing to build the contract tracing, the workforce?
So what we're doing is really a couple. We have over 600 CDC people now embedded throughout the country, but we've through our foundation, CDC Foundation is there to hire for the states additional personnel, and we can augment that substantially. That process is ongoing. In addition, obviously, we've dispersed the resources that you all have given us to the states to encourage them. And some states have already, I know, hired on their own over 1,000 individuals that are being trained as contact tracers to work under the supervision of the people that they hired through our foundation. And we're going to continue to do that. And lastly, I'm hopeful that AmeriCorps will also in each of the states be having a public health workforce that will provide more long-term augmentation of this public health workforce. So we're working state by state by state to see them augment. And as I mentioned, some states have already augmented over 1,000. Finding that magic number, I don't know. I do think in some states it's going to be over 5,000 people, maybe 10,000. In other states, it's going to be 300 to 500 people what they need. But it is fundamental that we have a fully operational contact tracing workforce that can every single case, every single cluster can do comprehensive contact tracing within 24 to 36 hours, 48 hours at the latest, get it completed, get it isolated, so that we can stay in containment mode as we get into the fall and winter of 2020.
Thank you. And Madam Chair, if I may just follow up with one more thought on this, on contact tracing is, you know, we're watching all these peaceful demonstrations, and I know a lot of people are very close together. So I just would like your, what are you advising the states if the number of cases overwhelm contact tracing abilities?
Yeah, I think the first thing I would like to see is those individuals that have partaken in these peaceful protests or been out protesting, and particularly if they're in metropolitan areas that really haven't controlled the outbreak to the extent we want. Minneapolis happens to be one that was still having significant transmission. DC is another one. We really want those individuals to highly consider being evaluated and get tested, and obviously go from there. Because I do think there is a potential, unfortunately, for this to be a seeding event. And the way to minimize that is to have each individual to recognize it's to the advantage of them to protect their loved ones, to, hey, I was out, I need to go get tested, you know, and in 3, 5, 7 days, go get tested, make sure you're not infected.
All right, well, I don't think you answered that question, but you know, the question was, what are you advising the states if they're overwhelmed and they don't have the contact tracers?
Yeah, I want to work with the states so they don't get to that pace. I agree with Tom Friedman. We need to build that workforce, so they need to work with us now to make sure they have they're over-prepared. This is not an area that you need to skimp and be under-prepared. This is a time to be over-prepared. And if you hire extra contact tracers, then you can use them to help with our HIV elimination program or vaccination program or maternal child health program. But this is not a time to be understaffed.
Thank you, Madam Chair. I yield back.
Thank you.
Congresswoman Frankel.
Thank you, Madam Chair. Dr. Redfield, I have a softball question for you. Older adults represent a high-risk group for COVID-19 with a higher hospitalization, mortality rates, and CDC correctly is telling them to stay home. But we also now see that this isolation is exacerbating loneliness, stress, mental health challenges, making it more difficult to obtain food, fill prescriptions, be physically active. So my question to you is, would CDC benefit from an increased collaboration across agencies during the pandemic, as well as the pandemic, beyond the pandemic, to meet the public health needs of older Americans?
I think you raise really critical questions. As you said, many older Americans who have stayed at home have then also had negative consequences of isolation, lack of human connectedness, obviously other issues into maintaining the critical activities of life. They've also necessarily maybe not gotten the preventive medical care for the chronic illnesses that they need. You know, we're committed to continue to work and figure out how to maximize the health and well-being of these Americans, and any way that we can assist. I know this is an important issue for you, and we're prepared to learn and assist to help improve that. This is the critical target group, unfortunately, for this particular virus is those of us, and I'm in the group. You know, I'm 68, older Americans.
Thank you, Madam Chair. Just to remind you, I know we've talked about this, that I have filed, we filed a bipartisan legislation that would establish a national COVID-19 resource center for old Americans within HHS and establish a healthy aging grant program at the CDC.
Good.
I thank you, and I yield back.